to take over the session. Welcome to you, sir.
अथा तो वमनविरेचना साध्य उपवचिकित्सकं व्याख्यास्यामः यथोवाच भगवन्तमन्त्रिः. After Snehana and the Svedana, the next is about the Shodhana, and the Shodhana, Vamana and the Virechana are the major important steps there. Now, the principle of Shodhana is Doshaha, Kshinaha, Brahmaitavyaha, Kupisaha, Prashamitavyaha, Vruddhaha, Nishkartavyaha, Samaha, Paripalyaha, iti Siddhantaha. Now, the basic principle of the treatment is the doshas which are in the normal condition, they should be protected and preserved, and if they have become abnormal, kupitaha, they have to be corrected, and if they have become reduced in quantities, their quantity has to be increased so that balance is maintained, and if there is a increase in the quantity and they are vitiated, they have to be removed. Now, the removal of the doshas from the body, removal of a pathological entity from the body, extraction of a pathological entity of the body is a unique concept of Ayurveda, which is not seen in the contemporary system of medicine. Contemporary system of medicine doesn't have that kind of an idea where the disease entity can be removed out of the body. Of course, the surgical treatment is the next level. Now, the Shodhana is the first level. Surgical removal is the next level where the vitiated tissues are removed. Whereas in the contemporary system, that surgical treatment of removal of the tissues which are affected does exist. But that in between step where the tissue is not in a abstract form, the pathological entity cannot be identified separately, but it still can be removed. And this is a unique concept of Ayurveda which need to be highlighted. And the whole idea of that removal of the entity also is very methodical, scientific, and their methods are pradhanyena vamanavirechane vartete nirharane doshanam tasmat tayoh vidhanam uchyamanupadharaya atha aturam snigdham swinnam abhishyandipi aharehi anamabadha dosham avalokya शो वमनं पायिता अस्मीति संबोधयेत् तीक्ष्णाग्निं बलवन्तं बहुदोषं महाव्याधिपरीतं वमनसात्म्यं च. The whole idea or basic principle of the Shodhana is the abnormal vitiated pathological entities of the body, they have to be separated from the normal tissue, and they have to be brought to the channel through which it can be extracted out, and the channel is mainly gastrointestinal tract. So it has to be brought to the Mahasrotas, and then it has to be extracted out or expelled out either from the oral route or from the anal route, from the proximal side or the distal side. This is the basic idea as such. To facilitate this, the Snehana and the Svedana procedures, they help in liquefaction of these pathological entities and separating these pathological entities from the normal content, and they are brought to the main course or main channel of the body. And to these procedures are always to be done after Snehana and the Svedana, which is an essential component of the Shodhana chikitsa. And then the Bhavati Jatra पेशलैः विविधैः अन्यैः दोषान् उत्क्लेशदेहिनः स्निग्धस्विन्नाय वमनं दत्तं सम्यक् प्रवर्तते. So before the vamana, you have to give some snigdha ahara, or which is sticky also, which can help in separation of dosha. Dosha utklesha is a very specific word. Utklesha, of course, the literary meaning is disturbing. Now, it's not really disturbing, it's rather something like separation. And the simile given is something like the butter extracted from the curds. When the curd is churned well, the butter gets separated, and that kind of a simile is given. But the separated doshas may not be directly visible as such as a butter. Anyway, that's the idea. Then atha aparedhyuh purvanye sadharane kale वमन द्रव्य कषाय कल्कचूर्ण स्नेहानाम् अन्यतमस्य मात्रं पाययित्वा वामयेत् यथा योगं कोष्ठ विशेषम् अवेक्ष्य असात्म्य बीभत्स दुर्गन्ध दुर्दर्शनानि च वमनानि विदध्यात् अतो विपरीतानि विरेचनानि. Now, once you have prepared the patient, preferably in the early morning hours, the vamana dravya has to be given in the form of either kashaya or kalka or churna or sneha, in any form, depending upon the patient's condition. And the dose also has to be decided based upon the status of the patient and the cost. Now, about this vamana dravya, there is a slight improvement or a difference of opinion between Charaka, Sushruta and Vagbhata. Vagbhata, I will come to that part like next asset. Then the vamana dravya or vamana, during the vamana, the patient would have some expelling out foul smelling substances which are not really easily acceptable, and the vamana also can be induced by making the patient see something which is not acceptable, some foul smelling or maybe which produces some awe. That kind of the substances could be given. Although viparitani virechana, in the virechana it's not that way. Something which is disliked by the patient is not given. Instead, it is something which is really liked to the patient given in virechana. तत्र सुकुमारं कृशं बालं वृद्धं भीरुं वमनसाध्येषु विकारेषु क्षीरधृतितक्र यवागुन् अन्यतमम् आकण्ठं पायेत. Before the vamana, the patient has to be given either milk or curd or maybe the buttermilk or yavagu, that's the ganji. They should be given till the full, to the stomach is full, and then Pitaushadam Panibihi Agnisatihi Pratapimanam Hurtam Upeksheta. After giving the vamana aushadhi, you have to keep the body warm by rubbing the hands and wait for 1 muhurta kala, something like around 40 minutes. तस्य च स्वेदप्रादुर्भावेन शिथिलताम् आपन्नं स्वेभ्यः स्थानेभ्यः प्रचलितं कुक्षिम् अनुसृतं जानीयात्. When the patient starts sweating, that's a proof that the doshas are reaching to the stomach or the abdominal area, so that the woman now can occur. So initiation, there would be a sign of sweating. ततः प्रवृत्तहल्लासं ज्ञात्वा जानमात्र आसन उपविष्टम् आप्तैः ललाटे पृष्ठे पार्श्वयोः कण्ठे च पाणिभिः सुपरिगृहीतम् अङ्गुली गन्धर्वहस्त उत्पलनालानां मन्यतमेन कण्ठम् अभिस्पृशन्तं वामयत् तावत् यावत् सम्यक् वान्तलिङ्गानिति. Then you make the patient sit in a comfortable position, and the assistant has to support the head and neck asset, and you may, if necessary, you may stimulate the induction of the vomiting by touching the palate with some soft substances like, or maybe finger as such, so that the vomiting occurs properly. Now, as far as the vamana substances, vamaka substances are concerned, in Charaka Samhita, in Sutrasthana, Charaka has mentioned Madana Palakashaya Matra Pramanam to Sarva Samshodhana Matra Pramanani. Madana Palakashaya is considered as a suitable vamana dravya for all the vamana conditions in Sutrasthana. Whereas in Siddhisthana, there are variable, lots of other yogas which could be mentioned as per the dosha. प्रतिपुरुषम् अपेक्षितव्यानि भवन्ति यावद्धि यस्य संशोधनं पीतं वैकारिकदोषहरणाय उपपद्यते न च अतियोग अयोगाय तावदस्य मात्राप्रमाणं वेदितव्यं भवति. The quantity of the drug would be again decided by custom made quantity. There is no specific dose mentioned in Charaka, and what Charaka says is any quantity which produces the vamana in the proper manner, which produces the samyak yoga without producing any harm to the patient, then that should be the option. Vagbhata suggests like the vamaka dravya should be selected according to the dosha of the patient. Kafe tishnosna katukehi pitte swadhimediti vamet snigdhamla lavnehi samsiste maruta kafe. In case of kapaja vyadhi, tishna usna katu dravya has to be given. In pitta, sweet and shita bija dravya has to be given. And in case of Maharuta Vyadhi, Snigdha Amla Lavana Dravya has to be given. So, selection of the vamana dravya according to Vagbhata would be according to the dosha of the patient. But Charaka in one context says like it should be Madana Palakashaya in all. As far as the clinical experience is concerned, the vamana dravya may not have such a significant effect upon the doshas. See, that initial snehana, it has a significance. See, what I would prefer is snehana dravya should be selected according to the dosha of the patient, so that the initial dosha vishyandana would be proper. Vamana dravya is it can be given anything which produces the vamana comfortably. It may not be selected according to dosha, and of course Madana Pippali is always better than any of the others. It need not be according to the doshas. Now this is a point of contention. What Samhita says is it should be selected according to dosha, but practically it need not be. It can be any of the dravya given would produce a similar effect, but the later part of Sansarjana Krama is a quite important thing. Whereas again Charaka Siddhisthana, he suggests like Alpamatram, Mahabegam, Bahudoshaharam Sukham, Laghupakam, Sukhaswagam, Prinanam, Vyathinashanam, Avikaricha Vyapaktavu Nati Glanikaram Cheta, Gandhavarna Rasopetam Vidyat Matravad Aushadham. The dravya, any of the substance which produces the vamana and in sufficient quantities, the vamana producing sufficient quantities, but the effective in even small quantities, and which is easily digestible and has a better appreciable taste, produces a comfort to the patient. That should be the selection of the drug. So drug selection would be according to Charaka in the Siddhisthana, it's about the palatability and acceptability of the patient, may not be according to the doshas. Vagbhata suggests the selection of the drug according to the doshas. Of course, all these are practically may be correct, but as far as the clinical experience is concerned, that differences in the selection of the dravya may not be very significant, but as far as the palatability, of course, it is true that the drug which is easily, which is comfortable, which makes a comfortable vamana is preferable. Bahudashchatra, the Lakshanans of vamana are Kapha Prasekam, Hridaya Vishuddhim, Kandum, Duscharditalingam Ahu, Pittati Yogam, Visanyatam, Huskanta Pidam, Ativante. If there is an excess of vomiting, it produces kapha praseka, excess of salivation, and discomfort in the chest, itching. These are the duschardita, abnormal or improper vamana as such. Whereas in case of ativanta, pittati yogam, there will be excess of the pitta expelled out and impaired consciousness. Pain in the chest and neck could be the signs of ativanta, excess of vamana. पित्ते कफस्य अनुसुखं प्रवृत्ते शुद्धेषु हृत्कण्ठ शिरस्सु चापि लघौ च देहे कफसंस्रवे च स्थिते सुवान्तं पुरुषं व्यवसेत. सम्यक् वमनलक्षण is the sequence of the doshas which come out would be initially it is the foot, then the kapha, then the pitta, and the vamana should end, that emesis end once the pitta comes out, and the patient should have a comfortable feeling. There should be no discomfort in the chest or the throat, and should feel light. That's the sign of Samyak Vamana. Samyak Vantam Chayanam Abhisamiksha Snehana Virechana Shamananam Dhumanam Anitam Samarthita Payitva Ajarikam Adisheta. After the Vamana, Dhumapana is one of the essential components. This is to clear the respiratory tract, the pharynx and upper portion of the pharynx as such. And this Dhumapana has to be given with the either Snehana or the Virechana or the Shamana Dhumapana. Now, as far as the Samyak Lakshana, the proper signs, the Charaka has mentioned in Siddhisthana, the Samyak Lakshana based upon the other criteria. The criteria for the Samyak Lakshana are Jaganya Madhya Pravaraitu Vegaha Tatvara Ishtaha Vamane Sharasto Dashaivate Bit Trigunaha Videke. The one is about the number of Vegas. Samyak Lakshana could be by counting the number of the emetic activity, and according to Charaka, 4 Vegas are considered as Jaganya or Laghu Vamana, where the total quantity is less than optimum. Madhya is 6 bouts of vomiting, and when it is 8 bouts of vomiting, it is considered as a pravara, the severe. Now, Jaganna Madhya pravara could be depending upon the patient's condition. So in a weak patient, it should be always a laghu, and a very strong patient should be the other way. So it's not that the total number of Vegas would be deciding or a universally deciding criteria for the signs of proper Vamana. The number of Vegas should be decided based upon your requirement in the patient. Whereas the similar number of Vegas in case of Virechana is Dashaiva, they be 3 gunaha. In the Virechana, 10, 20 and 30 are considered as the Jaganya Madhya Pravara. Then that's what's called as a Vaigiki Shuddhi. The next is about the quantity of the vomitus. Prasthastada Bistri Chatur Gunashta. The Vamana, 1 prastha or 2 prastha or 3 prastha, the quantities of the vomited out, the vomitus, is the other criteria. If it is 1 prastha, it is a Jaganya, 2 prastha Madhya, and 3 prastha is the Uttama as such. Then Pittan, that's what we call as the Maniki Shuddhi. Then Pittantam Ishtam Vamanam Virekad Ardham Kapantam Je Virekam Ahuhu. Now, in the Vamana should end once the Pitta comes out, and in the Virechana it should end once the Kapha comes out. This is what we call as the Antiki Shuddhi. Then when you count the number of Vegas, in case of Vamana, you have to avoid that counting of the bouts till whatever the substance which is consumed in is expelled out. Whereas in Virechana, when the feces are accompanied, they should be avoided from counting. So you start counting once all the substances which are consumed are omitted out, which have drunk earlier has omitted out. In case of Vamana, whereas in case of Virechana, till the feces have come out. So Dutran, Sabitkan, Apaniya Vegan, Mayam, Vireke, Vaman, Pitam. So first 1 or 2 of the bouts should not be counted. Kramat Kapvaha, Pitam Atha Anilascha, Yasage Samya Gomita Swaishtaha, Hrutva Shumudha, Indriya Marga Shuddhotaka, Lagupe, Lakshmane. So Samya Vamanavirechana mentioned in Charaka Siddhi has many more criteria. So the Lakshanika Suddhi is and the patient has the same. That's what Sushruta has said, like where you will have a comfortable feeling in the chest, even head, and so on. Now, Bhavanti Chatra, Tato Aparane, Shuchi Shuddha Deham Ustabhi Adbihi Parishiktagatram, Kulat Muggadaki Jangalana, Yushi Raseba Api Ubhojayato. So after the Vamana, in the afternoon, patient has to take a warm water bath and then give a yusha with kulatamugga, etc. A laghu dravya has to be given. Usually, only the liquid component of the grains, cereals which are boiled. Now, Charaka has very clearly mentioned about that. The patient should not be allowed to fast. It should be only the laghu ahara has to be given, and it's absolutely essential that the patient should be given some liquid food after in the afternoon after the Vamana. Kasopadepa swara bheda nidra tandra asya laudandya visha upasargaha kapha praseka grahani pradoshaha nasanti jantoho vamata kadachita. If a person has a regular habit of the Vamana treatment, then the diseases like Kasa, swara bheda, nidra, tandra, these kinds of issues would not occur. Chinne paro pushpa phalapraroha yatha vinasham sahasa prajanti tata hrite shleshmani shodhanena tadya vikaraha prashanam prayanti. As a plant which is cut properly would not have the leaves and fruits, similarly the kapha dosha which is expelled out by the Vamana would not result in kaphaja vyadhi. Now, as far as the foods and the discipline of the food to be given, in the later Charaka and Sushruta, they have given very detailed protocol of the Samsajanakram, and practically this is absolutely true and absolutely important. More than the real procedure of Vamana and Virechana, the Samsadhana is the most critical part of the Vamana and Virechana, and most of the times it is neglected in the clinical practice. And in Vagbhata, the protocol is Peyam, Vilepim, Akritam, Kritanja, Yusham, Rasam, Treen, Ubhayam, Tataikam, Kramena Sevet, Naro, Annakalan, Pradhana, Madhya, Avara, Shuddhi, Suddha. Vagbhata has mentioned in summary like Peya, Vilepi, and Yusha, Krita or Akrita Yusha. for 3 food times in the sense, in the our correct methodology, the food time should be only maximum 3 per day, or twice or thrice, not more than that. So for the first 3 food times it should be prayer, then the Vilapi, then the Akritayusha, then the Kritayusha has to be given. Charaka has given it still more in a detailed manner, almost same. अथ एनं सायाह्ने परे नि सुभोगकपरिषिक्तं पुराणानां लोहितशालितण्डुलानां स्व अवक्लिनां मण्डपूर्वां सुकोष्णां यवागुं पायेत् अग्निबलम् अभिसमीक्ष्य एवं तृतीये च अन्नकाले the same what's mentioned in Bhagavata is given in detail. चतुर्थे अन्नकाले तथा विधानेमेव शालितण्डुलानां उत्स्विन्नां विलेपी उष्णोदकद्वितीयाम् अस्नेहलवणाम् अल्पस्नेहलवणां वा बोधयेत्. That vilepi with some more details given in Charaka, where you may have lavana, a salt may be added, and it should be having warm water. Evam panchame shashte annakale saptame tu annakale tatha vidanam shalinam dvit prasrutam, the 2 prasruta of the shali susvinnam odanam ushnodakanupanam tanuna tanusneha lavana upavannena mudga yushena bhudeta. The same, whatever is mentioned in Bhagavata, it's given in more detail, like which are the substances which could be given, like rice with the mudga. Evam ashtame navame cha annakale dashame tu annakale lavaka pinjaladina maniramasya mamsarasena audaka lambanikena nakisaravata bhujayeti ushnodaka anupanam. The mamsarasa can be given in the next day. Evam ekadashe dwadashe cha annakale अत ऊर्ध्वं मन्यगुणान् क्रमेण उपभुञ्जानः सप्तरात्रेण प्रतिभोजनम् आगच्छेत्. By 7th day, the person can adopt the normal food practices. नवामे ये तैमेरिक ऊर्ध्ववात गुल्म उदर प्रीह कृमि श्रमार्कान् स्थूल क्षत क्षीण कृश अतिवृद्ध मूत्रातुरान् केवल वातरोगान् सर्वोपघात अध्ययन प्रसक्त दुश्चर्दी दुःखोष्ठ तृणात्म बालान् ऊर्ध्वास्त्रपित्ति क्षुधिप अतिरूक्ष गर्भिणी उदावर्ति निरोहितांश. The vamana should not be given in the patients with Timira Vyadhi, Urdhvavarta, Gulma, Udara, Priha, Krimi, etc. And very important is Adhyayana Prasakta. Those who are studying students, they are not supposed to give the vamana. And the patients who is having abnormal kosta, Dukkosta is where the kosta is not normal. And the Raktapitta, Garbhini, Budavarta, these are the contraindications for the vamana. Avamya vamanat rogaha krichatamyanti lehinam asadhyatam agachanti naive vamyaha tatasmraha. In a avamyam condition, if you give vamana, it can become, the condition can become more serious and it will be incurable as such. Yetepi adirna vyatitaha vamyaha, yete vishaturaha, adhivate ulpanakapaha, te syuhu madhukamana. Suppose the similar conditions are, they say, contraindication, but they have severe adirna or they have other kapaja vyadhi along with that. In that condition, vamana can be induced as a mild vamana with madhukamana, st madhuka patha. Vamyastu, the specific indication for the vamana are Visha, Shosha, Stanya dosha, Mandagni, Unmada, Apasmara, Shlipada, Arbuda, Vidari, Vidarika, Medo, Mera, Meha, Gara, Jara, Aruchi, Apachi, Amatisara, Rudroga, Chitta Vibhrama, Visarpa, Vidradhi, Adirna, Mukhapraseka, Rilasa, Shwasa, Kasa, Pinasa, Puti Rasa, Kantausta, Vaktrapaka, Karnasrava, Adijifva, Upajifika, Gala Shundika, Adha Shonita Pittina, that's Adogara Pedipa, Kapasthanjeshu Vikareshu, Anyacha Kapavyadi Paripraha iti. The list of the diseases where vamana is specifically indicated, and in these conditions vamana can be given. Now, as far as the contemporary view as vamana, there is no contemporary similarity of that vamana. There are many studies which are done, attempts are done to identify how the physiological changes would occur during the vamana, but no conclusive evidence of such things could be established with the contemporary parameters, though we can definitely observe the clinical outcome. Patients having the relief of the disease for a long time is known, as far as the signs of the vamana, the issues which we need to take care of the vamana based upon the contemporary science issue, because during the inducing of emetic act now, from the contemporary science point of view, that vamana with the protocol of previous snehana and svedana and the omitting, there is no difference known as per the contemporary science. But whenever you omit, the issues which would occur would be, there will be initially the intestinal pressure would increase, then the abdominal pressure will increase, the muscles would become more contracted and the vomiting occurs. Now during these phases, there will be some changes in the body which are like the hormonal changes which can occur during nausea and vomiting, would be the hormonal changes which occur in the gastrointestinal tract, like the chemoreceptors, mechanoreceptors, they get stimulated, and these have a link with the cardiac functioning too, and hence there will be always some amount of tachycardia during the vomiting as such, and during vamana procedure also there will be tachycardia, shalasa would be there. As far as what we observe is, it's not going to harm in any way, it may not produce any severe issue, but still some changes in the ECG during the vamana are now recorded and well known. From the safety point of view, it is better to avoid vamana in a patient who has already a history of ischemic heart disease or maybe evidence of ischemic heart disease earlier, though such serious fatal complications have not been reported any time. From the safety point of view, that's one of the issues which you need to consider. Similarly, patients who have undergone gastrointestinal tract surgeries, it's better to avoid vamana because it produces sudden increase in the pressure within the GIT, and hence that's another of the precaution. And patients with the impaired consciousness or patients who have a high risk of aspiration, that vamana could be contraindicated, avoided. That's, I don't say contraindicated, they could be avoided from the safety point of view, and this is from the current physiology understanding. But as far as the benefits, clinical benefits are concerned, modern science is not able to identify those benefits, though those benefits are obviously seen. That's about the vamana in brief. The next is about the virechana. Virechana api snigdasthvinnaya vantaya cha deyam avantasya hi samyak viriktasya api sato adhasrastah shleshma grahanim chadayati gauravam apadayati pravahikam janayati. According to Sushruta, virechana should be given after snehana and svedana and then vamana. So the vamana is an essential part of the virechana preparation according to Sushruta. Practically, this may not be applied in every case. It may not be applied. But as far as the theory of Sushruta, if vamana is not given and the virechana is directly given, the kapha which will be reaching to the grahani, and hence it can produce complications like impaired digestion or even pravahika. Abnormal bowel movements could be the complications of giving virechana without the previous vamana as such. There should be always a gap, a minimum gap of minimum 2 weeks. The samsarjana krama 1 week, then the patient has to have a vishrama kala, the time duration, and as per the general protocol, there should be 2 weeks gap between the vamana and the virechana. अथ आतुरं शो विरेचनं पायेतास्मीति पूर्वाह्ने लघु भोजयेत् फल अम्ल उष्णोदकं च एनम् अनुपायेत् अथ अपराह्ने अपरेहनि विगत श्लेष्म धातु आतुर उपक्रमणीयाद् अवेक्ष्य आतुरम् अथ अस्मै औषधमात्रं पातुं प्रयच्छेत्. So if we are planning for the virechana, again it should be followed by snehana and the svedana, and the previous day of the virechana, patient should be given laghu ahara with the phala amla ushnodaka, warm water and maybe the fruit juices, and the next day the patient should be ensured that the kapha signs do not occur in the patient would not have a kapha prakopa, and then you have to give the virechana aushadhi after some food. Tatra mruduhu kruro madhyama iti trividha kosto bhavati. Tatra bahumitto mruduhu sadudhenapi virichyate. बहुवेतश्लेष्मा क्रूरः सदुर्विरेच्यः समदोषो मध्यमः ससारण इति. When you select the virechana dravya, it's better that you have to have an idea about the cost of the patient. If the patient is Mrudu Kosta, the Dravya which should be given should be smaller quantity and Mrudu Dravya should be given. In Akrura Kosta, it has to be higher quantity is to be given. And the Kosta is of three types. And it's a Bahupitta Mrudu. Person who has a more Pitta would be Mrudu, and he will have a purgation even after consuming milk. Whereas Kapha Vataja person, Kapha Vataja Prakriti would have Kruda Kosta, where it is difficult or it may not produce that. Now, Tatra Mrudau Matra Mrudvi, Tikshna Krure, Madhya Madhya Kartavya iti. The dosage and the selection of the drug would be depending upon the kosta of the patient. Pitavadasya Tanmanaha Shayabhyase Virichyate. Virechanam Pitavamsu Navegan Dharayat Buddha Nimatashayi Shikambu Nasprishet Na Prabahet. Now, after the consumption of the Virechana Aushadi, the patient should take rest, should not exert himself, and should not induce the urges, nor even suppress the urges. So once he feels the urge, he has to go for the defecation. Yatha cha vamane praseka aushada kapapittandaha kramena gachanti evam virechane mutra purisha pitta aushada kapaha iti. In the as in case of the vamana, it starts with the salivation, then the medicine, and then the kapha would go get expelled out. Similarly, in the virechana, it's the urine, feces, then pitta, last would be the medicine, which is and kapha would be expelled out during the virechana as such. Bhavanti chatra hritkukshi ashuddhihi talilaha kandu vinmutra sangashcha nasabvirikte. If improper virechana would produce the lakshanas like a discomfort in the chest and abdomen, burning sensation, itching, and constipation or obstipation or reduced urine output can occur in case of asamyak yoga, improper virechana. In ativirechana, excess like murcha, buddhabhramsha, kafati yoga, shuloggamascha ati viriktalingam, impaired consciousness, or even prolapse of the rectum, or any other excess of the kapha lakshanas could occur in case of ativirechana lakshana. Gateshu dosheshu kapanyuteshu naksha lagutve manasascha tusto gate anile chapi anulom bhavam samyak viriktam manajam vyavasyeta. Now, a proper sign of virechana would be the doshas would be reduced, and the patient would have a feeling of lightness in the abdomen and a very comfortable feeling. And the vata would be anuloma. You will have that proper movement of the body contents in the body. That's the sign of samyak virechana. Mandatnim akshinam asadviriktam napayet ahani tatrapeyam kshinam trishartam subirechitam sannim sukosnam dadupayecha. If the patient is having a reduced digestive capacity and the patient otherwise is stronger and the virechana is not proper, then on that day you do not give any food to the patient. But if the patient has samyak virechana lakshana, then he is relatively weak and has thirst, then warm water should be given. Buddheha prasadam balamindriyanam dhatustiratvam balamadnidiptam chiracha pakam vayasak karoti virechanam samyak upasyamanam. Proper practice of the virechana would produce a comfortable intellectual capacity, strength of all the indriyas. The body becomes stronger, digestion capacity becomes better, and the aging process will be reduced. It's a rasayana. Yatha audakana mudake apanite charasthirana bhauti pranashaha pitte hridete evam upadravana pittatmakanam bhauti pranashaha. Given virechana given would avoid all the pittaja vyadhi, and similarly given by Sushruta is like when the water from a water pond is removed completely, the animals or the living being in the water would be just dry themselves. They would dry up. When you have dried up a pond, all that fish and other living beings in that pond would die. Similarly, pittaja vyadhi would not occur in a patient. Mandagni atisnehita bala vruddhastulaha shatakshina bhaya upataptaha shantaha trishartaha aparijirna bhaktaha garbhini adho gacchati yasya cha asraka nava pravishyaya नव प्रतिष्ठाय, it should be नव प्रतिष्ठाय मदात्यै च नवद्वरीया च नवप्रसूता शल्यार्जितश्चापि अभिरेचनीयाः स्नेहादिभिः ये तु अनुपस्कृताश्च. These are the important things. अत्यर्थपित्त अभिपरीतदेहान् विरेचयेत् तानपि मन्दमन्दम्. Now, the conditions like manda, gnati, sneha, etc., there should not be the virechana should not be given. And one of the very important precautions is virechana should not be given without sneha dibhi anupaskrara, sneha and svedana. Without sneha and svedana, virechana should not be given. So the idea of sadhyo virechana and so on, that's not really the correct protocol. But even in these contraindications, if the patient has severe pittaja vyadi, then manda mandam virechayat, mridu virechana can be given. विरेचने हि अन्ति नराः विनाशम् अज्ञप्रयुक्तैः अविरेचनीयाः. If the virechana is not given properly in the conditions where there is no specific indication, then it can result in severe fatal complications as such. Virechyastu, specific indications for the virechana are jvara, gara, aruchi, arsho, arbuda, udara, granthi, vidradi, panduroga, apasmara, हृद्रोग, वातरक्त, पगंधर, छर्दी, योनि रोग, विसर्प, गुल्म, पक्वाशय रुक is a pain in the abdomen, विबंध, विषूचिका, अलसक, मूत्राघात, कुष्ठ, विस्फोटक, प्रमेह, आनाह, प्रीह, शोक वृद्धि, शस्त्रक्षत, क्षाराग्निदग्ध, दुष्टव्रण, अक्षिपाक, काच, तिमिर, अभिषंद, शिर, कर्ण, अक्षिनास, आस्य, गुद, मेघ्रदाह. So burning sensation in these areas. ऊर्ध्वर रक्तपित्त, कृमिकोष्ठी, पित्तस्थानजेषु अन्येषु च विकारेषु अन्ये च तैतिकव्याधिपरीताः. Any of the pittaja vyadi with along with these specific indications. सरत्व, सौक्ष्म्य, तैक्ष्ण्य, औष्ण्य, आविक, अविकाशित्वैः विरेचनम्. ओमनं तु हरेर्दोषं प्रकृत्या गतमन्यथा. The virechana द्रव्य would produce the virechana because of its saraguna, sukshma guna and tikshna guna, and vamana would be producing by the opposite properties. यात्यधो दोषम् आदाय पच्यमानं विरेचनं गुणोत्कर्षात् व्रजति ऊर्ध्वम् अपक्वं वमनं पुनः. Any of those substances or any of those protocols which bring the doshas downwards, they are considered as virechana. Any of those substances which bring the contents in a retrograde fashion towards the opposite side or opposite direction, they are considered as vamana. So selection of the drug could be according to the other options. The Sushruta doesn't specify any specific substance could be given in virechana. As far as the clinical experience is concerned, of course, what I would prefer is a virechana which is more comfortable will be Trivritleha, which doesn't produce severe purgation, doesn't produce much discomfort. Any of the Tikshna virechana dravyas, they produce pain. So I would always prefer Trivritleha for all the virechana conditions, irrespective of the doshas. Of course, selection could also be according to the doshas. There may be more significance of selection of the drugs according to the dosha in case of virechana than in case of the vamana. मृदुकोष्ठस्य दीप्ताग्नेः अति तीक्ष्णं विरेचनं न सम्यक् निर्हरेत् दोषान् अतिवेगप्रधावितम्. If you give a virechana in a mridukoshtha patient with the tikshna virechana, that may not result in a proper formation of the vega. There could be excess of the complications. पीतं यदौषधं प्रातः भक्तपाकसमेक्षणे पक्तिं गच्छति दोषांश निर्हरेत् तत् प्रशस्यते. A optimum virechana dravya should be given in the morning, and by the time it gets digested, it starts expelling out. So at least 4 to 5 hours of gap between the dravya, virechana dravya and the beginning of the virechana should be there, and that's the optimum dravya. If any substance starts induction of the virechana earlier than that, that also is not proper. It takes more time, also is not proper. दुर्बलस्य चलान् दोषान् अल्पान् पुनः पुनः हरे प्रभूतान् अल्पांस्तु शमेत् प्रत्युतान् अपि. If the patient is very weak and virechana in a single sitting may not be optimum in that patient, then it could be he may give small doses of the drug repeatedly as such. हरे दोषांश्च चलान् पक्वान् बलिनो दुर्बलस्य चला हि उपेक्षिता दोषः क्लेशयुः चिरं नरम्. once the sneha and svedana is done and dosha have become utklishta, then they need to be expelled out. If they are not expelled out properly, that dosha which is accumulated may produce more harm as such. And of course, after the woman or the vilechana, some amount of dosha should be left over, and that should be protected or that should be taken care of by the samsadhyana krama. Mandagnim krurakoshtam च sakshara lavanaikritihi sandukshitagnim snigdam च svinam chaiva vilechayeta. You have to ensure that the patient would have a samyak agni or digestion capacity is increased in a patient of mandagni before you give the vilechana. स्निग्ध स्विन्नस्य भेषज्ञैः दोषस्तु उत्क्लेशो बलात् निरीयतेन मार्गेषु स्निग्धे भाण्ड इवोदकम्. The proper snehana and svedana is an essential protocol to make the vilechana comfortable, and Sushruta has given a simile like a vessel having oil layer can be, now that water which kept in that kind of a vessel with the layer of oil can be easily cleaned, or the water gets expelled out easily comfortably. Similarly, the snehana done earlier would facilitate the vilechana. न च अतिस्नेहपीतस्तु पिबेत् स्नेहविलेचनं दोषाः प्रचलितास्थानात् भूयः क्लिश्यन्ति वर्त्म. So the if the patient is having the snehana in with the excess of snehana earlier, and if you give a sneha vilechana in the form of snigdha dravya, then that could be more harmful. It can produce the dosha shesha. विष अभिघात पिडका शोफ पान विसर्पिनः नाति स्निग्धाः विशोध्याः स्युः तथा पुष्टिक प्रमेयः. Patients who have visha abhigata etc., and once the snehana is done properly or excess of snehana is given, then do not give the virechana. विरुक्ष्य स्नेहसात्म्यं तु भूयः संस्नेहे शोधयेत् तेन दोषाः हताः तस्य भवन्ति बलवर्धनाः. A person who is having a habit of consuming sneha dravyas, then your sneha dravya which is given for the snehana may not produce a samyak snigdha lakshana, sneha ajirna doesn't occur. In such patients, you have to prepare the patient by rukshana. So avoid that consumption of the sneha dravya for a considerable period, and then you have to give the snehana so that the patient would have samyak snigdha lakshana as such. Prag apitam naram shodhyam पायेत औषधं मृदु ततो विज्ञातकोष्ठस्य कार्यं संशोधनं पुनः. The vilechana should be given after the patient has consumed some soft food substances. Then if the patient is in an empty stomach condition, then the vilechana dravya should be always mrudu aushadhi. Otherwise, some light food has to be given, then the vilechana has to be given after the food. That saves the patient's condition as such. Sukham drishchapalam sadyam alpamatram mahabudam vyapatsu alpateyam chayapi pived nripatihi aushadam. Preferably, the drug which you should give should be having a proved effect and should be comfortable, and comparatively smaller quantities should be producing the vilechana. That should be the optimum dravya which could be selected, because you have plenty of options of the vilechana dravya. In the dravya guna, we have discussed about that vilechana dravya, vilechanopaka dravya, and so on. So among them, selection of the drug would be according to your comfort as such. Sneha sweda anabhyasya yastu samshodhanam pibetu dar shushkamiva aname dehastasya vishiyate. Any of the shodhana procedure which is done without the sneha and svedana can produce more harm to the patient, and the simile given is like a dry wood gets broken down when it is attempted to be bent. स्नेहस्वेद प्रचलिताः रसैः स्निग्धैः उदीरिताः दोषाः कोष्ठगताः जन्तोः सुखाः हस्तं विशोधनैः. Sneha and Svedana will facilitate the expulsion of dosha from the kostha. With this, we will conclude this chapter. Iti Sushruta Samhitayam chikitsa sthane vamanavirechana sadhya upadravati kesalam nama trayastrimshodhyayah. If there are any questions, we will try to answer and then wind up. Right? Okay, there are no questions, so we will wind up today.